Wow, guys, okay, so you've made it to the last presentation. You're preparing for class. This is your last one, and here we're going to talk about the stress response. This is an important to understand the tie between stress and inflammation in the body. So what is stress and what types are there? Well, stress is a physiological and a psychological reaction to either perceived or a real threat or some sort of challenge. And it's triggered by internal or external stressors. What that means is an external stressor might be like somebody's following you in the parking lot at night that you don't know and it scares you, right? Internal stressor might just be the freaking out about an exam, some sort of thought that's triggering emotions, okay? So that's what we mean by that. Now, the types of stress, it can be acute, where it's short term, and it's an adaptive response that triggers your body to prepare for fight or flight. And once the stressor is gone, you're good, right? Or it can be chronic, where you're having this prolonged exposure, and that can actually lead to maladaptive changes, not just in your psyche, but in your body. The key players in stress response are going to be your central nervous system. That is where you process that you are perceiving a threat. We also are going to have the hypothalamic pituitary adrenal axis, or the HPA axis. This is going to regulate hormone response. And we have the sympathetic nervous system, or the SNS, which activates our fight or flight. I hope this sounds familiar to you and that you learned all of this in physiology when you took it. There are phases of a stress response. We have the alarm phase, where we activate the sympathetic nervous system. You saw the bear, you saw the stranger in the parking lot, you get all those little pins and needles in your body and your hair starts to kind of feel like it's standing on edge. That's your alarm phase. We have the resistance phase, which is where the hypothalamic pituitary adrenal axis gets activated. And then you have the exhaustion phase. This happens in chronic exposure, where you're constantly under stress. Kind of like Dr. Hill right now. The alarm phase. So during that sympathetic nervous system activation, this is the crucial response to stress. This is the fight or flight right here. And the main things that happen here is activation. So you perceive the stressor, that hypothalamus activates the sympathetic nervous system, which prepares the body to either fight or to run away from the threat. It does that by activating the heart and the blood vessels. So the sympathetic nervous system increases the heart rate and the blood pressure, and it does that by sending a signal to the little muscles on the outside of the blood vessels and tells them to constrict. And that ensures, why does it want to constrict blood vessels? Because it wants to push blood and oxygen and nutrients to the essential organs and the muscles. Why? You need the muscles to either fight or flight, right? So in the respiratory system, it's going to cause dilation of the bronchioles in the lungs. And that is because it wants you to be able to take in more oxygen so that you can get up and have that heightened physical activity. In the digestive system, the sympathetic nervous system activation of the alarm phase is going to slow down digestion, because nobody wants the blood flow to be diverted to the stomach to digest your hamburger when you're supposed to be fighting or running away from the creeper in the parking lot, right? So that the blood flow is decreased to the gut and it's transitioned to other places like your muscle. That's going to conserve energy so that we can fight or flight. The other organs get impacted, things like the pupils, they dilate so you can see better to get away from the stranger. You're going to have increased sweat production to cool the body when you're running or fighting, and it's going to mobilize energy stores by stimulating the release of glucose from the liver. This is an important thing. I'm not just going over old physiology here. I'm doing this for a reason. This increased glucose in the blood. So it's going to drive up your glucose level in your blood. I want you to remember that, because think about it. If you're constantly in the alarm phase, if you have chronic stress, what's it going to do to your glucose? If you're taking care of a patient who has just recovered from a motor vehicle accident or major surgery and they are stressed, what is it going to do to their glucose level? If you're screaming at the screen right now going, Dr. Hill, it's going to increase it. You're getting it. You're getting it. You're thinking like a nurse. So overall, the sympathetic nervous system is going to orchestrate this comprehensive physiological response to help make sure that the body can adequately run from or fight off whatever the perceived threat is. So In the resistance phase, this is where the HPA axis is stimulated. So the hypothalamus is going to detect the stress. And as a result of that, it's going to say, oh, you need more corticotropin releasing hormone, or CRH. So it releases that. The hypothalamus does. The CRH moves its way down to the pituitary gland in the brain, and it tells the pituitary to release adrenocorticotropin hormone, or ACTH. Now, the hypothalamus and the pituitary, again, are in the brain, and ACTH is going to act on the adrenal gland, which sits on top of the kidney. ACTH tells the adrenal gland to secrete cortisol. And why is this needed? Well, cortisol is going to help homeostasis because it's going to mobilize energy stores so that we have enough energy for fight or flight, and it's going to suppress all non-essential functions like digestion and reproduction. Nobody needs to be out like, making babies when we're fighting or running away from a creeper in the middle of the parking lot. So cortisol is actually known as the stress hormone. It helps the body manage stress because it increases glucose availability and it suppresses non-essential functions so that it modulates our immune response. That helps the body respond effectively to an immediate acute stressor. But, and here's the big but, when stress is chronic, we have chronic activation, and we chronically have cortisol being released, it can actually cause health issues, anxiety, depression, and dysfunction of our immune system. Cortisol is, again, the stress hormone, and it has a significant impact on the immune system. It causes immunosuppression. So cortisol can suppress our immune system because it reduces the production of some of those cytokines, which are crucial for our immune response. That can make it harder for our body to mount a defense against an infection, making it more susceptible to an infection. It can also slow down the healing process. So if you have a patient that has a wound and they are stressed and we don't resolve that stress, then they are going to end up having slower healing times for their wounds. Inflammation regulation is impacted by cortisol. We've talked about that for this entire unit. So cortisol helps control inflammation, but chronic high levels can lead to an overactive immune response, which is going to cause excessive inflammation. That's going to cause things like autoimmune disease, where the immune system is attacking the body's own tissues. The balance and the timing of cortisol is important because cortisol has an impact on the immune system that is all about balance. Short-term elevation of cortisol can be beneficial, helps the body manage an acute stressor and inflammation, but prolonged elevated levels of cortisol lead to negative effects like increased vulnerability to illnesses. So in essence, cortisol plays a dual role in modulating this whole system. It has protective and potentially harmful factors depending on the context and the duration of its release. In the exhaustion phase, this is where we have chronic stress. The stress has been too long. It has caused an overaction of that HPA axis, which has caused elevated cortisol levels. It's impacting the immune system, so it's causing increased susceptibility to infections and chronic inflammation. It has cardiovascular effects. It causes hypertension, which is also known as high blood pressure, and atherosclerosis, which is the development of plaques on the inner lining of your blood vessels, which can become unstable and burst, or they can break off and become little clots that form and block flow to different parts of your body, including your heart, causing it to fail, or your brain, causing a stroke. The neurological impacts, it causes anxiety, depression, and impairment of your memory. So the higher the cortisol, the higher the chronic stress, the worse you are able to think. It can cause metabolic changes like insulin resistance, weight gain, or weight loss. And it can cause gastrointestinal disorders like ulcers and irritable bowel syndrome. What are some of the things that cause somebody to have an impaired stress response? Well, it can run in your family. So we do know that there's a variability in HPA axis sensitivity that does run in families or is associated with different genetic conditions. It can also be related to your early life experiences. If you had neglect or trauma in your childhood, you can end up with impaired stress response. Chronic diseases like diabetes and hypertension can cause it, and of course, the chronic stress in turn makes them worse, right? Environmental stressors, socioeconomic challenges. If you live in a part of the United States, so here we go, social determinants of health again, where you don't have access to good health care, you don't have access to good education, you don't have access to transportation, it's harder for you to get a job. If you don't get an education, it's harder for you to get a job that will pay well over time. So you're struggling financially for your entire life, and you're probably stuck in a job that you hate. Those are environmental stressors that can actually increase the risk for chronic stress that negatively impacts your health. This is how social determinants of health impact somebody's health. And it's not fair. Life isn't fair. And also there are lifestyle factors. Poor diet, lack of exercise, substance abuse, all of those things can impair the stress response. Allostasis is a concept that describes how the body maintains stability throughout change. So when we are impacted by a stressor, how do we respond to it? This is not like homeostasis, which is trying to keep this kind of constant internal condition. Instead, allostasis has these dynamic adjustments that take place in order to meet the demands imposed on us by our environment. And there are key points. Number one is anticipation and adaptation. So allostasis involves the body's ability to anticipate its needs and adjust its physiological processes based on those needs. This might be things like changing the hormone level or the heart rate or the use of energy because, again, you're being followed by a creeper in the parking lot, right? The stress response. So during the stress response, the body is going to use allostatic mechanisms to adapt. For example, it's going to increase your heart rate and blood pressure to prepare you for that fight or flight. Chronic stress, this is where you have prolonged activation of these allostatic processes, and this can lead to what's called allostatic overload or allostatic load. And this is where the wear and the tear on the body can contribute to various health issues like cardiovascular disease and metabolic disorders like type 2 diabetes. Flexibility is another factor in allostasis. Allostasis emphasizes the body's ability to be flexible and adapt to change in its internal environment to cope with external challenges. So in essence, allostasis is all about the body's ability to achieve stability through change, ensuring that it can effectively and predictably respond to both predictable and unpredictable stressors. Allostatic overload. This happens when the body's adaptive mechanism to stress, which is known as allostasis, is overused or fails to shut off properly. So this can lead to a state where the physiological systems are chronically and constantly activated, and it causes wear and tear on the body. The key points are as follows. Chronic stress. Allostatic overload is often the result of chronic stress, where the body is just repeatedly being exposed to these stressors without any time to really recover between them. Physiological impact of this prolonged activation of the stress response can cause a bunch of different health issues, including cardiovascular disease, diabetes, and even mental health disorders. And that's because we're having this continuous release of stress hormones like cortisol and adrenaline. Wear and tear, allostatic overload, emphasizes that there's kind of a cumulative damage that stress can inflict on the body over time. And this is the wear and tear effect that affects multiple systems, including our immune system, our cardiovascular, and our nervous system, by being constantly overly activated. And the consequences of allostatic overload to your health is that it can result in a bunch of different health problems like hypertension, obesity, and overall decline. And it can also increase the risk of developing chronic illnesses. So basically, when you have allostatic overload, it's going to highlight how detrimental the effects of prolonged stress are on the body and underscore the importance of effective stress management and recovery. Clinical manifestations of chronic stress are going to be physiological, like anxiety, depression, irritability, sleep disturbances. Physically, they can be fatigued, have muscle tension, have chronic pain, have headaches. And behaviorally, it can lead them to have a poor diet. They can not want to get up and move. They might become very kind of hermetic, kind of not being social, and they can rely on substances, whether it's alcohol or cannabis or whatever, to try to relieve that chronic stress and anxiety. For us as nurses, we assess our patients. We have to look for common signs of stress, whether they are from injury and disease or psychological, and we have to understand what the symptoms of that are. We use validated tools like the perceived stress scale. We teach techniques or interventions to manage stress, like relaxation, physical activity, good sleep, promoting social support and therapeutic counseling. And then we monitor for the chronic stress effects. We're going to take people's blood pressure, which you're going to learn how to do in health assessment. We're going to test their glucose levels. You're also going to learn how to do that. And we're going to do mental health status exams. So these are things, this is how all of this ties together: your health assessment, your long-term care, your fundamentals course, and your patho course. They all tie together. And here you got to really put everything together to understand the stress response is a vital adaptive mechanism, but it can be harmful when it's chronic. So monitoring and managing stress, it takes a really holistic or overall broad approach, including lifestyle modification and psychosocial support. So you did it, you made it through module 2. You are ready and prepared for class. Take your quiz, come in prepared to be active, and apply what you have learned.